Dr. Fauci, I hope the American people listen very carefully to Chairman Paul's opening statement. I think it's a stunning indictment of the actions you've taken that have been so destructive to global health. I certainly understand why you needed a pardon. I certainly understand why, on the advice of counsel, you're not answering any questions, because I think it would be almost impossible for you to answer the questions truthfully without really demonstrating what you did, your culpability, self-incriminating. We have, all of us, has prepared a lot. I've been deluged with questions to ask Dr. Anthony Fauci. There are so many legitimate questions that deserve answers, and now you're not willing to provide those answers. So with my limited time, I'm going to talk about things that my investigation have revealed that have not been adequately answered and, quite honestly, haven't been adequately covered by the legacy media. I'll kind of combine the questions into kind of one, but you know, I certainly, let's put up the last COVID chart. I was warned pretty early on about the dangers of the experimental gene therapy that you've called a vaccine, but it really falls under the definition of gene therapy. So I was going to ask you, I mean, were you carefully monitoring the safety surveillance systems like VAERS and vSafe that literally were deluged with complaints? You know, currently, worldwide, there have been almost 1.7 million adverse events reported to the VAERS system. Of those, over 39,000 were deaths. And of those deaths, 24% occur on the day of vaccination within 1 or 2 days. 24%, which, by the way, just happens to be the same percentage that a Rasmussen poll pointed out the American public believe 24% of the American public believe they know somebody who died of the experimental gene therapy. So again, I was certainly interested in asking you whether or not you were following this as carefully as I was. It was not my responsibility to follow safety surveillance systems, but I did. And by the way, when I published, this is actual government information. When I published it and people had me on their shows, they would be censored by Facebook. They would be deplatformed. I think largely at the behest of the actions you took to make sure that disinformation wasn't spread. This wasn't disinformation. This was the truth. So I was going to ask you whether you knew Dr. Marks. I think you do know him. He's the head of CBER. He's the man who is in charge of approving vaccines and surveilling for the safety. My investigation shows that on March 1st of 2021, less than 3 months after the emergency use authorizations, he was warned by Dr. Anna Scharsman, data mining expert, that the algorithm they were using to analyze VAERS data was going to hide in mass safety signals. 26 days later, and 3 months consecutively after that, they did data runs with a new algorithm that unmasked those safety signals. They showed dozens of safety signals, including sudden cardiac death, cerebral artery occlusion, basal ganglia stroke, agonal rhythm, Bell's palsy, and pulmonary infarction. Your diaries now show that you actually suffered pulmonary infarction in, I think, probably June 2021. I was just wondering whether it ever went through your mind that maybe that injection, all those boosters you took, might have caused that. You know, and the question I was going to, and I'll ask this question, were you ever made aware of the fact that Peter Marks was warned that the algorithm was going to hide the safety signals? And were you told that senior FDA officials were given shown dozens of safety signals associated with the COVID injection?
On the advice of counsel, I respectfully decline to answer based upon my rights under the Fifth Amendment to the Constitution.
Next area I want to go through is In that same month of March 2021, an employee at NIH, Dr. Nath, led a team of researchers who were diagnosing and treating individuals who'd never had COVID, but were severely injured by the genetic therapy injections. Dr. Nath told those individuals, stay quiet. We want to make sure that we gather all the information and then release it to doctors so they can treat people like yourself. There was a concerted effort, and I'll enter this into the record. It appears inside NIH to quash Dr. Nath's publishing of that study. It finally was put on a preprint server with telling no one, and I think about May of 2022. I think what's noteworthy about this is Dr. Nath told the injured participants that early treatment, early intervention was crucial for them to be treated. And yet within the NIH, they were questioning what was Dr. Nath doing. They didn't want to publish that because, and I want to take time searching for it, because publishing it would create vaccine hesitancy, which is what we continue to hear time and time again, is the reason they didn't promote they lied about the safety signals they were seeing. Throughout the pandemic, I always pushed early treatment. We've got things in here where you were really concerned about remdesivir because it was untested, but hydroxychloroquine, yeah, it was an approved drug. Maybe some safety issues, but we had a great deal of experience with it. All of a sudden, you had the Surgisphere study. It was retracted within 2 weeks because it was completely false, totally blew up the use of hydroxychloroquine. And then when it comes to ivermectin, which, by the way, because I was contacted by so many people, I referred them to doctors who actually had the courage and compassion to treat vaccine-injured individuals. It works. But I was going to ask you whether you were involved in the FDA attack on ivermectin. You had a interview on CNN on August 29th of 2021, where, again, I just don't want to take time to find the exact quote, but you said there's no evidence that ivermectin is helpful. On that exact same day, and I've got the studies right here. There was a website that was tracking the random controlled studies. Here they are, showing 60, 70% efficacy of ivermectin. The same day you say there's no evidence, there was all kinds of evidence. Loved ones had to go to hospitals, had to sue hospitals. Just, would you try it? So I would want to know, to what extent were you involved in sabotaging hydroxychloroquine, ivermectin, and did you do that because you knew the only way you get an emergency use authorization for these drugs, these experimental gene therapy, was if there was no effective treatment, you couldn't get the emergency use authorization. So is that why you helped sabotage these cheap generic drugs in favor of remdesivir, which, by the way, nurses, are you aware of the fact that nurses called it run, death is near?
On the advice of counsel, I respectfully decline to answer based upon my rights under the Fifth Amendment to the Constitution.
Let me end on this note because this just came to light. We've got 11 million pages of documents. We also have other people who were in the room. But now you actually lied to your own diary. On March 27, 2020, you wrote in your diary, "To my surprise yesterday, the POTUS sent a letter to governors outlining a plan to reopen county by county while monitoring the spread of virus in the low-risk counties. This was half-baked and never shown to Deb or I before it was sent out." So we have evidence that, in fact, you were fully aware of it and certainly approved, if not authored it. So I was just simply asking you, is that true? Did you literally lie to your own diary? Did you know of that letter sent out to governors about reopening county by county? Again, Mr. Chairman, I'd ask you to ask the witness to just answer that one simple question.
On the advice of counsel, I respectfully decline to answer based upon my rights under the Fifth Amendment to the Constitution.
Thank you, Mr. Chairman. You mentioned that we lost knowledge of natural immunity. I didn't. Dr. Fauci did. I suppose I had an asymptomatic case of COVID because of the very faulty PCR test. I never got vaccinated or injected. There's no way I would have done that because I found out enough about the mRNA gene therapy. But you also brought up the issue of hospital protocols. I'm going to be holding a public event on hospital protocols. We've already received a couple hundred testimonies. They are heart-wrenching. They are heart-wrenching. Here's an excerpt from the testimony of a staff surgeon, very experienced, doctor for decades, at Providence Regional Medical Center, Everett, Washington. Quote, after our hospital was given remdesivir by the CDC, we were provided misleading/inaccurate information about the drug by our medical leadership. When I had a young trauma patient who was a perfect candidate for remdesivir, the infectious disease doctor on call told me to not give it to her because, quote, she seemed like a nice girl. He concludes it was known early the remdesivir kills. As I said, nurses referred to it as run, death is near. So again, I've always been, it never made sense to me that we put all of our eggs in the experimental gene therapy. If you knew anything about it, you would have avoided it like a plague. And we sabotaged early treatment. But the only treatment we really approved, monoclonal antibodies, which I think basically worked pretty well, but those weren't particularly available. They were denied an awful lot of patients. It was all remdesivir. Based on a study that the NIH changed the endpoint from mortality, because it had no impact on mortality, to days of recovery. A drug that the WHO recommended against its use in COVID in November of 2020, but a drug that cost over $3,000 for a course of treatment, versus things like ivermectin, hydroxychloroquine, who even Dr. Fauci, I should have got that one out because I want to take this time to enter things in the record, said that, we need to have a very tight protocol on remdesivir because it's unknown, but hydroxychloroquine, that's approved, some side effects, but we have a long history of it. Let's put up my latest chart. Again, I was tracking adverse events on the experimental injection, but I use this chart as a comparison. So you've got ivermectin, hydroxychloroquine. These are average, again, Avayers doesn't improve causation, but there's correlation. It's there for safety signals. So ivermectin, over 30 years of FDA reports, 17 deaths per year. Hydroxychloroquine, over 38 years of reporting, 142 deaths per year. Remdesivir, over 5.5 years, 546 deaths per year. The COVID injection, almost 7,000 deaths per year. Which is safest? What did the FDA freak us out about ivermectin, hydroxychloroquine, when they turned a complete blind's eye toward the injection's injury? So I want to enter the quote from the surgeon. By the way, here's the answer. Cheryl Atkinson in an interview said that when it comes to money, we check financial ties among experts on the government panel devising coronavirus treatment guidelines, which had the effect of dialing back hydroxychloroquine use and giving an edge to remdesivir. We found the 11 members reporting links to a drug company, 9 of them named relationships to remdesivir's maker, Gilead. 7 more, including 2 of the committee leaders, have ties to Gilead beyond the 11 months they had to disclose. 2 were on Gilead's advisory board, others were paid consultants who received research support and honoraria. By the way, within the study, I think one of the study participants was an employee of Gilead. A bunch also had conflicts with Gilead. So, I wonder why. There are conflicts of interest. Gilead made billions of dollars off of remdesivir and people died. In terms of ignoring safety signals, you can probably put that down now. This has come to light. This is Dr. Drew Weissman, who got the Nobel Prize for the mRNA platform. He wrote to Dr. Fauci on February 8th of 2020. Tony, I wanted to alert you to some new data we generated with our mRNA LNP vaccine. Now, it was a higher fold dose, but that mRNA LNP go to the placenta and fetus measured by translation of the mRNA and cause of immune response in the amniotic fluid. So that same day, Dr. Fauci responds, it'd be interesting to see what human dose levels given intermuscular due. So about a month later, Dr. Wiseman replies, he said, we still have some concerns over the data after they tested it IM. Now, again, there's more documentation in terms of the FDA blew it off. It's like, don't worry about that. That was the whole thing. That's what Peter Marks did when he was shown that his algorithm was going to mask safety signals. The last thing I want to enter in the record here is, and I want to make the point, why is this important? That they buried the treatment of severely injection injured. The fact that we haven't acknowledged these injection injuries, these people can't get treatment. They're being gaslit by their doctors. So it's all in your head. The rate of the injection injured of suicides is increasing because they've given up hope, because our medical establishment and federal health agencies completely failed them, failing to acknowledge it. So again, Dr. Nath was diagnosing and treating injection injured in March of 2021. This concerned people. So you had Dr. Walter Koroshitz, writes Dr. Fauci. One of the points he made, there's been a steady, slow stream of reports to me of post-vaccination neurological conditions. Dr. Nath has been collecting a bunch. He has reports sent out to publish. Well, that alarmed everybody. Boy, you can't let the public know what's actually happening. You can't actually let the public know what the science is showing. So on April 29th, a email from Francis Collins, head of NIH, to Dr. Koroshitz, says, I find this approach troubling and will have the main consequence of feeding vaccine hesitancy and social media overreaction. Then Dr. Lawrence Tabak writes to Francis Collins, I don't understand why Walter does not shut this thing down. Why don't you shut down Dr. Nath, who's actually treating injection injured? Why? Because of vaccine hesitancy. And because we haven't acknowledged that, and the reason I've been advocating for this is because I know the injection injured. I know people who lost loved ones within days of the injection. And we've turned our backs on them. They deserve acknowledgement. They deserve to be heard, seen, and believed so they can get treatment. I also know the doctors whose careers were destroyed because you denigrated things like ivermectin and denied ivermectin to people in hospitals who got their kidneys knocked out by the remdesivir but got put on ventilators, never got to hug their loved ones goodbye because of those hospital protocols. That's what your science did to people. So, Dr. Fauci, my only question is, based on your lack of testimony here today, based quite honestly on our investigation into the cover-up of safety signals and injection injuries, we have issued letters to a number of former FDA officials to come in for transcribed interviews. You will be getting a letter today asking for a volunteer transcribed interview. So I'd be asking, will you comply or will I have to subpoena you?
On the advice of counsel, I respectfully decline to answer based upon my rights under the Fifth Amendment to the Constitution.
Expect a subpoena. Thank you.